Welcome back to the channel. In the world of modern medicine, we've become incredibly skilled at treating the body. We monitor vitals, manage symptoms, and rely on technology to sustain life. For patients with end-stage kidney disease, the hemodialysis machine is a lifeline, a testament to medical progress. But what happens when we focus so intently on the mechanics of survival that we overlook the person connected to the machine? Today we're exploring a dimension of healthcare that is often overlooked yet profoundly transformative. A dimension that goes beyond the physical, beyond the lab values, beyond the machines. It's about the inner world of the patient, their hopes, their fears, their search for meaning in the midst of a life-altering illness. We are talking about the spiritual needs of hemodialysis patients. And when we say spiritual, we're not just talking about religion. We're referring to the universal human need for purpose, connection, and peace. It's the part of us that asks, why is this happening? And who am I beyond this illness? This video is inspired by the peer-reviewed work of Aga Khani, Iwalds-Quist, Alisha Hihesar and colleagues, published in the Journal of Client-Centered Nursing Care in 2025. Their crucial research shines a light on something many dialysis facilities miss: the spiritual suffering that patients quietly carry. This isn't just an academic exercise, it's a call to action. The study reveals a significant gap in care, where the emotional and existential weight of dialysis is often left unaddressed, leaving patients feeling isolated and unheard. By understanding their findings, we can learn how to provide care that heals not just the body, but the whole person. Let's dive into what they discovered and why it matters for every single person involved in healthcare. Hemodialysis is more than a medical treatment. It's a life-altering journey. Patients face physical exhaustion, emotional strain, psychological distress, loss of independence, fear of the future. But as Aga Khani and colleagues emphasize, there's another layer, one that often goes unnoticed: spiritual distress. Patients may ask, why is this happening to me? What is the meaning of my suffering? How do I stay hopeful? These questions aren't captured in lab results, but they deeply shape a patient's quality of life. According to the author, spiritual care isn't a luxury, it's a therapeutic necessity. Research shows that spiritual support can improve mental health, reduce anxiety and distress, strengthen resilience, enhance coping, restore a sense of meaning and hope. When patients feel spiritually supported, they don't just survive dialysis, they live through it with greater strength and dignity. So what does spiritual care actually look like in a dialysis setting? It's a fair question. Amidst the hum of machines and the clinical precision of treatment, it can be easy to overlook the non-medical needs of a person. But spiritual care isn't a separate, isolated task. Instead, it's a compassionate approach woven into the very fabric of patient interaction. It's less about a specific protocol and more about a fundamental shift in perspective, seeing the whole person, not just the patient tethered to a machine. Drawing from their extensive research, Aga Khani and colleagues outline several key practices that can be integrated into the demanding environment of a dialysis unit. These aren't abstract ideals, but tangible, actionable methods for providing holistic support. First, and perhaps most fundamentally, is active listening. Sometimes the most powerful intervention is simply being present and offering undivided attention. This means putting down the chart, making eye contact, and truly hearing what is being said and what is left unsaid. It's about creating a safe space where patients feel they can express their fears about the future, their hopes for their family, or their deep existential questions without fear of judgment. It's a gift of stillness in a world that is often loud and overwhelming. The second practice is respecting beliefs. Spirituality is deeply personal and incredibly diverse. For one person, it may be rooted in organized religion, finding strength in prayer and scripture. For another, it might be found in cultural traditions, a connection to nature, or a philosophical framework that gives life meaning. Caregivers must approach each patient with an open, non-judgmental curiosity, honoring their unique worldview. This respect is shown by asking about what gives them strength, rather than making assumptions. Third is creating space for reflection. The hours spent in a dialysis chair can be long and monotonous. Transforming this time into an opportunity for peace can be a profound act of care. This might be as simple as ensuring a patient has privacy by drawing a curtain, helping them access music or a guided meditation on a tablet, or making them aware of a quiet room or chapel within the facility. These quiet moments or access to spiritual resources can make a profound difference in a patient's ability to cope and find inner peace. Fourth is collaboration with chaplains or spiritual counselors. Nurses and technicians are on the front lines, but they don't have to be the sole providers of spiritual support. Integrating trained spiritual professionals into the care team strengthens holistic support immeasurably. Chaplains are skilled in navigating complex spiritual and existential distress. Knowing when to make a referral is a crucial skill, ensuring patients receive specialized care when their needs extend beyond the scope of the clinical team. And fifth, encouraging hope and meaning. Hope is a vital resource for anyone facing a chronic illness. This isn't about offering false reassurances, but about helping patients reconnect with what gives their life purpose. It could be their role as a grandparent, their passion for a hobby, their faith, or simply their own inner strength and resilience. By asking about their life beyond the clinic, caregivers can help patients anchor themselves to their identity and find reasons to persevere. These practices don't require expensive equipment or extensive training. They are, at their core, acts of profound humanity. They require awareness, compassion, and the simple, powerful intention to care for the person as well as the patient. The authors argue that spiritual care should not be an afterthought. It should be woven into everyday dialysis care. Here's how facilities can integrate it. Train staff to recognize signs of spiritual distress. Include spiritual assessments in patient evaluations. Offer access to spiritual counseling. Encourage interdisciplinary collaboration. Normalize conversations about meaning, hope, and emotional well-being. When spiritual care becomes routine, patients feel seen not just as bodies, but as whole human beings. Dialysis keeps the body alive, but spiritual care helps keep the spirit alive. Aga Khan and colleagues remind us that healing is not only physical, it is emotional, psychological, and deeply spiritual. When we honor all dimensions of a patient's humanity, we elevate the quality of care and the quality of life. If you're a nurse, a technician, a dedicated caregiver, or a healthcare leader shaping the future of patient services, consider this your personal invitation. In the midst of demanding schedules, clinical protocols, and the constant hum of machinery, it's easy to focus solely on the tasks at hand. This is an invitation to pause, to breathe, and to reconnect with the profound human element at the heart of your work. It's an invitation to look beyond the physical, beyond the charts, the lab values, and the treatment times. It's a call to listen for the unspoken, the anxieties hidden behind a quiet smile, the questions about meaning and purpose that arise during long hours of treatment, the deep-seated need for hope when the body feels frail. This is our chance to support the spirit, not just the body. It can be as simple as asking, "How are you really?" or creating a quiet moment for reflection. It's about acknowledging the whole person, validating their spiritual journey, and providing a safe space for their beliefs and their doubts. A heartfelt thank you to Aga Khani, Ewald Quist, Alisha Hiazar, and their team. Their vital research brings much needed attention to this essential and often forgotten aspect of dialysis care, reminding us that true healing encompasses mind, body, and spirit. If this video moved you, inspired you, or opened your perspective on patient care, please help us spread this crucial message. like, subscribe, and most importantly, share it with your colleagues and within your professional networks. Every share can spark a conversation. Every conversation can shift our perspective, and every shifted perspective brings us one step closer. Together, we can create a more compassionate, holistic future for dialysis care, one patient, one interaction, one moment of spiritual support at a time.